Okay, Aida, you are live.
Great, thank you, Julia. And we're starting soon, so for everyone who's here.
Okay, everyone, welcome. Aida, are you ready to go?
I am. I do want to know, Guillermo's not here yet, so.
Oh, okay.
Do we want to wait a minute or?
Maybe a minute and then we'll just get started.
Okay, great.
Okay, why don't we get started? We're still waiting for one committee member, but he can log on in the middle. That'll be fine. First of all, I just want to welcome all of you to this really important milestone event. Today is Aída Guhlincozzi's final exam. So this is the final defense of the dissertation. And it's really an incredible pleasure and honor to welcome all of you here. I'd like to mention her committee members. We have Julie Siddell, who's here, and Trevor Birkenholtz from Penn State is here. Great to see them. And I'm not sure if Guillermo is here, but he will be shortly. I also wanted to mention that tragically, one of Aida's committee members died last summer, Dr. Edna Viruel Fuentes, and she was a leading figure in this field. So it's really, really sad that she's not here today, but I'm sure she would be incredibly proud. So I'd like to start by saying a few words about Aida. As I said, this is the final defense of the dissertation, and it represents 5 or 6 years of incredibly hard work and perseverance and, learning and exploring. And it's been an incredible pleasure for me to work with Aida these past 5 or 6 years. She contacted me as a junior at Texas A&M University and said that she's interested in working with me for grad school. And I thought, oh, a junior, I'll never hear back from her. But of course I did. And she came for her master's degree and stayed on for the PhD. And Aida is one of the most goal-oriented students, I have to say, I've ever had. When she first arrived at Illinois, she told me she wants to get an NSF graduate fellowship. And those are highly competitive national fellowships. And I said, oh, great, let's apply, let's work on the application. But I said, these are really competitive. They're hard to get. Well, what did Aída do? She dived into it, put all her energies into it. And that spring, she learned that she got an NSF fellowship. Same thing happened 2 years ago. She came to my office and said that she and Julia wanted to do a summer camp for middle school girls to learn geosciences. And I said, oh, that's a great idea, but that's a lot of work. And so we worked on the IRB application, and I thought, well, she'll lose interest. No way. That summer, they had an incredibly successful summer camp for middle school girls. So Aída has great leadership qualities, great goal orientation. She applies herself 110% to everything she does. And I know she will be successful in the future. I used to tell her that she'll be a university president someday. I'm not sure, maybe a dean or something like that, but she definitely has that talent. So without further ado, I want to turn this over to Aída, who will speak about her dissertation, which looks at Latina's access to healthcare in the Chicago suburbs. So take it away, Aída.
Thank you so much, Sarah. You've been a wonderful advisor in response to all of my goal-oriented, almost harebrained schemes. So thank you so much. And I am very excited to share my research with all of you today. And so I'm going to, here we go. And just to confirm, does everyone see my main screen? Somebody.
Yep, we can see it.
Awesome. Thank you. And now
And subtitles. There we go.
Awesome. Okay. So, hi everybody. My name, as mentioned, is Aída Guhlincozzi, and I'm thrilled to be presenting my research today to you on constraints encountered by Latina immigrant and immigrant-related women and the community organizations supporting them in the Chicago suburbs. Now, I'm going to open with a healthcare anecdote from one of my research participants. However, as a general content warning, the next minute or so will include a story about pregnancy loss. And since this is a highly sensitive topic, if this is something you need to step away from, you can mute me until the slide changes to a completely new slide, and you will be able to listen to the rest of the presentation without necessarily hearing about the specifics of that situation. And so I'm going to give everyone a second if anyone needs to mute me. And okay, so this is an extended quote from one of my CBO participants who is describing a situation from CBO being community-based organization, from one of her clients. And I'm going to take a minute to read this quote, and on the next slide discuss the major themes this quote holds that is exemplary of my dissertation. So it begins with, for example, recently I had a mom call me. It was a Friday evening, and she just kind of mentioned, hey, I'm not feeling well, what should I do? So I personally would always refer them to the ER. And at this point, I did not know that she was pregnant. She goes to the ER. She calls me the next week, and she's like, they sent me home. She also doesn't speak English, so I'm not sure if she understood what the doctors were telling her. The point was that she lost a baby in that transition, and then she did have to go back to the emergency room, I think, 3 times. I guess they were telling her you need to go see a gynecologist at a clinic to so that they can keep up with your pregnancy. And it was really hard for her because she felt like it was something that she did. It's the whole, I knew I was pregnant. I should have gone to the doctor. I should have reached out. I should have done all these things, but she didn't know. She didn't know. She just came here. I think she's been here a year from El Salvador, and she doesn't really have a support system. So it was hard for her to seek somebody to help her at all. And she's doing well now, but it was just really traumatic and really hard for her. So that quote comes from Yesenia, who is a Cook County-based community outreach assistant. And bold is emphasis added by me. So while this was a secondary discussion of an experience by my interviewee, it's clear that this was a situation where the woman pursuing healthcare was failed by the healthcare system in ensuring that she understood what she needed to do because possibly of a language difference, and that she received the full follow-up care she needed, this immigrant Latina woman. And further, when this woman needed support, she turned to the organizer she knew at the community-based organization, who tried to connect her with the appropriate healthcare, showing that community-based organizations, or CBOs, are seen as sites of support for Latina women as they attempt to overcome the constraints to healthcare they encounter. And CBOs are also differently equipped to support these pursuits. This quote is really relevant to speak of at the beginning of my presentation because this dissertation incorporates both the barriers that Latina women experience in pursuing healthcare and the difficulties and efforts that community-based organizations have and make in supporting these women when they're pursuing that care. Examining healthcare access constraints for Latina immigrant and immigrant-related women requires investigating a larger web of interactions that goes beyond a population's distance to a healthcare facility. So my research question is, how do Latina immigrant women experience and manage space-time constraints when accessing linguistically appropriate healthcare? And how do CBOs, community-based organizations, understand these constraints and intervene to help Latinas overcome them? To address the part of my question regarding Latina immigrant and immigrant-related women, I want to address some of the barriers that we already know they face when accessing healthcare. We know Latina women are also those who are purposely seeking out and often responsible for finding social services, not only for themselves, but their household members, including healthcare. And because of this, my current research thus centers their experiences. One of the important behaviors to note that Latina immigrant women take on to manage the fear of another effective immigration policy is something called hyperinvisibility to prevent hypervisibility. Hyperinvisibility is a state that is taken on to avoid being persecuted in the United States because of a lack of documentation status, and thus subjects undocumented immigrants to being unable to access services they deserve just from being in the United States to avoid detection, and thus potentially deportation or hypervisibility. This is a concept I illustrated and defined in my recent paper in the Journal of Latin American Geography that I'm going to walk you through quickly. First, Latina immigrant women experience the grueling immigration process. And once they arrive in the United States, to avoid persecution by the federal government for being undocumented, they often find themselves in low-paying, high-risk jobs such as meatpacking industries, which unfortunately we all know now were leading sites of COVID-19 spread among predominantly Latinx workers. And now, with an illness or an injury, they find themselves having to stop being hyper invisible, a status, again, where they were more than invisible, but hyperly so, and thus missing out on important services such as preventative care, and visit the doctor, where they become at risk of hypervisibility, where their documentation status or lack thereof may merit unwanted attention and potentially even lead to a deportation. So, this issue of hyperinvisibility tells us some of what Latina immigrant women go through. We know citizenship plays a significant role in the ability of immigrant Latina women to have the same privileges as citizens, and thus both impacts their access to healthcare and capacity to overcome the barriers they experience. Because of these immigration statuses that are placed upon them when they enter the United States, they experience several barriers to accessible healthcare, including legislative barriers on immigration status, work opportunities based on their immigration status, income opportunities or income status based on those work opportunities, structural, gender, language, and racial and ethnic bias in healthcare institutions, a lack of childcare, and a lack of physicians and professional translators who speak Spanish. This forces a significant number of people into a vulnerable position where they not only lack access to healthcare, but so do their families. More than 50% of Latinx people are also uninsured in the United States, and non-citizens are significantly more likely than citizens to be uninsured, with 45% of undocumented immigrants being uninsured. And if they don't have access to linguistically appropriate healthcare, they are unlikely to be able to quickly and safely pursue other healthcare options because of their limited resources until the physician does speak the same language. And that need for language is crucial. I want you to just take a second, if you don't have this experience already, where you are going to the doctor because you're sick, you're not feeling well, and you're trying to communicate to the physician what is wrong. And the doctor doesn't speak the same language as you. And so they don't really understand what you're saying. But then imagine that the doctor is still trying to help you. And so they're trying to offer a treatment plan to you in the language that they speak, which also happens to not be the same language as what you speak. That care is going to be likely ineffective and potentially even harmful. So language is an absolutely crucial need to have in healthcare. So while these barriers may not be as difficult to navigate if the Latina immigrant woman is pursuing healthcare in the urban area, recent shifts in geographic patterns suggest that the urban area might not be the context that they are seeking healthcare within. In recent decades, there has begun a shift away from immigrant movement to urban areas in the United States to living in more suburban areas. And in 2010, more immigrants were found to be living in the suburbs than in the city. And this has occurred because of lower cost of living in the suburbs and shifting geographic patterns of job opportunities. And this movement of immigrants to the suburbs has an impact both on the suburb itself and the populations moving there. This includes an increase in Spanish-speaking population, isolation from the strong immigrant social networks of the city, and what is referred to as a lack of the infrastructure of civic institutions, such as policies that are found in sanctuary cities today, like the Chicago Executive Order passed by Mayor Harold Washington in 1985 that dictated and still does a number of protections for non-citizens in the city of Chicago. However, in the suburbs, with this recent group of people moving into the area, these protections may not exist yet. And further, the healthcare landscape also does not seem to be adequately meeting the needs of this newer population. And one of those needs, as we know, is crucially language concordance, where the physician and the patient speak the same language and are thus able to communicate effectively. And so to better understand this geographic perspective, I'm taking from Health Geographies literature on immigrants, which tells us that immigrants face multiple barriers to linguistically concordant healthcare, including bias in the healthcare institution, spatial mismatch of linguistically concordant services, and poorer health outcomes due to socioeconomic stressors, along with potentially different space-time geographies of healthcare. There are even fewer studies on the health geographies of Latina immigrant women, but what we do know is that Latinxes living in suburban or non-traditional locations often experience an impact on health outcomes because of a lack of social acceptance in the area, and issues of invisibility or hyper-invisibility and financial barriers. However, how these issues of immigrant health geographies actually bear out amongst Latina immigrant women's health geographies has only just begun to be discussed and explored in the literature. And so in order to apply new methods to this group and really suss out those details, I am drawing on the work of qualitative GIS researchers, critical digital geographies, and community geographers as they seek to explore other ways of qualifying GIS data through geonarrative without having begun the data collection from that viewpoint. And this comes from an attempt to take our data away from a view from nowhere with this idea, which is this idea that the data is created evenly with no bias in mind, and instead qualify it with specific experiences of another group that are not always in mind when creating this data, such as especially minoritized immigrant communities who may have very different experiences from those populations the data was created for. So with this community-oriented perspective, I use community geography methods which value civic engagement as a form of geographic praxis. and preferences, listening to community groups, following their guidance, insight, and needs in research question development. And soon, as I was doing this, I was researching the role of community organizations themselves and how they play a part in the process of healthcare access for Latina women, especially given the lack of research focusing on these groups in the suburbs. I also realized that the suburban landscape is influenced and shaped by the interactions between the government, community organizations, and the funding and collaboration that takes place between and within these groups, and how that affects both their roles and provision of social services to vulnerable groups, such as Latina immigrant and immigrant-related women. And again, I want to bring up the infrastructure of civic institutions, which I've defined again on this slide. This concept is relevant because this infrastructure is part of what community-based organizations and minoritized communities connect into when pursuing resources or advocating for change. And when examining community organizations and the services they provide, it's important to examine the varying contexts that they may be within the community-based organizations and the infrastructures of civic institutions they may be relying on to provide services. We know geography further impacts the opportunities to seek help and social services for clients, and that particularly vulnerable ones. But these issues and constraints those clients and organizations serving them encounter don't necessarily consider this concept of the suburban civic institutional infrastructure. So with this project, I'm looking at these issues in the specific geographic context of Illinois-based Chicago suburbs, which is viewable here on this highlighted portion of the map and showing my study area. And so to take all of that information and give you a way to better visualize how this all fits together, I see my research as having four main actors. One, Latina women. Two, community organizations or community-based organizations. Three, healthcare providers. And four, the neoliberal government at both the federal, state, and local level. My first paper looks at the healthcare experiences of Latina immigrant women, and specifically how healthcare providers and the neoliberal government both impact those healthcare experiences and access for Latina immigrant women. My second paper looks at the community organization interventions into those healthcare experiences to reduce barriers that Latina women have to overcome to access healthcare. And my third paper specifically looks at the community organizations and state interactions, examining how community organization efforts are shaped and constrained by the neoliberal government and their expectations and requirements for receiving funding. So please try to keep these actors and their interactions with one another in mind as we continue with the rest of the presentation, and you will see this slide again. So we're now going to look at the methods and findings of my first paper, focusing on Latinas immigrant healthcare access and experiences. So my method for capturing Latina healthcare experiences draws on online survey data and the following inclusion criteria, and I received 78 surveys from over 20 suburbs visualized here. I used qualitatively GIS mapping techniques that incorporated text and spatial analysis to thematically understand the spatial experiences of my participants in certain Chicago suburban areas. For recruitment, I had to be really creative due to COVID-19 and related social distancing expectations, and I quickly found myself visiting a wide range of locations, including panaderias, taquerias, lavanderias, community organizations, and essentially just sharing my flyers with these Latinx serving locations and eating a lot of really great food. So my respondent demographics, this is a younger set of respondents, and what this data and other information I have from my survey really show that this group was predominantly from a more recent generation of Latina immigrant and immigrant-related women, especially given the number of women that said they spoke English, but also served as ad hoc translators. As we're going to see, this group is well aware of their experiences in healthcare, but also the healthcare experiences of their family members. Again, a detail of being a procurer of social services. And so my findings from my first paper show that Latina women experience barriers that are financial, linguistic, and spatiotemporal. And we can see some examples here, such as when participants were asked why they didn't go to the doctor despite being sick, many stated it was because of an inability to pay. Others spoke of language discordance and being unable to bring a translator, likely an ad hoc one, which is again, a translator who's not an official licensed or officially educated to be a medical translator, but perhaps a family member or a good friend. When requested by a physician, they were unable to bring such a translator and then not receiving the appropriate treatment as a result. And further, when asked about transportation, some showed limitations as either not having a car or being fearful of certain public transportation options. With my qualitative GIS mapping approaches, I identified key themes of barriers that were spoken of by my participants, and then selected areas where there were a number of experiences around these themes to share, and looked for spatial patterns both in the GIS data and the experiences within those areas. And so we can see this is a case of a map of the Joliet area, which is farther away from the city of Chicago and the more western area. And this is where I've included in this map all of the healthcare data that I have available online from seeking various sources, and the nearest healthcare facilities by distance to the suburbs my survey respondents in this area are from, which I know it may be hard to see, but those dots are colored pink. So we can already see that while there are certainly some healthcare options, there are still some suburbs that are farther away from varying levels of accessible healthcare to these suburban locations, given the travel distances that they have to face. And further, all of the experiences that you can see on this map discuss a lack of Spanish-speaking services and even multiple descriptions of minors serving as ad hoc translators. So that is absolutely not meant to be allowed in any healthcare facility in the United States, but still is often happens very often. And now we have the location of Cicero, which is much closer to Chicago. And as we can see by the distances and also the many options, there's a number of healthcare options available in this area, which makes sense. It's a very dense urban area. However, we see again these discussion of language issues when accessing healthcare that's appropriate, and also a lack of translators available, or also just a lack of acceptance for communication difficulties. And so while we don't see complete linguistic concordance availability amongst the healthcare providers, we do see a mix of opportunities. So for example, this person right here spoke of always having a doctor who spoke mainly Spanish, but at the same time, a lack of options as well. And a lot of people speaking to the experiences of their family, or being even unable to translate because legally they aren't allowed to translate as ad hoc translators in most cases. And so this shows that regardless of locations throughout the suburbs of Chicago, there aren't a lot of linguistically concordant options regarding healthcare. And so language, proximity, and cost are really crucial when it comes to healthcare. And that's what this qualitative assessment shows, along with the others I've performed, and that the landscape we can see with the data collected from the government is not as clean and clear as the landscape that the public on the ground face. Further, Chicago is seen as the location to get care when it's not available where the participant is located, but that may be because Chicago is large and has options that are easier to see. But in the suburbs, options are fewer and also potentially harder to know about. Chicago, and also this lack of Spanish-speaking healthcare is an issue throughout the Chicagoland region, even in places with historically Spanish-speaking populations, and in those that are seeing rapid growth in the Chicagoland area. And so this need but lack of support results in increased waiting times, poor quality of care, and higher costs for Spanish-speaking populations, putting them at a disadvantage. So now we're going to move on to my second paper, discussing community organizers and interventions to reduce them for Latina women for paper 2. For answering both my questions for paper 2 and 3, I conducted 10 in-depth interviews with purposeful sampling of organizers located at 501c3 nonprofits that provide direct services to the Latinx community, such as through food pantries, like the one pictured here, healthcare services or immigration services, and I qualitatively analyzed these interviews for different themes. And much of the pivot towards community organizers in my research was due to COVID-19 and that interruption with in-person data collection. I connected with a number of community organizations as I was moving forward with recruitment, including with the Joliet Spanish Community Center, which is located where I am right now, and was invited to recruit through their food pantry by providing flyers in their food boxes while packing food boxes and distributing them. You can see a picture of me here after a long summer rainy Tuesday, giving out 100 plus food boxes and more of the food pantry located in a gym. And what I've learned from community organizations is that they are resource connectors trying to reduce the same barriers identified by Latina women, financial, temporal, and linguistic, but also informational. And the barriers they understood became even more exacerbated by COVID-19. And 2 examples I have mention both financial and linguistic costs. So Jessica at a Will County-based community center spoke of the increase in need for emergency cash assistance and how they went from only having a couple of $1,000s available for that resource to having over hundreds of thousands of dollars in emergency cash assistance moving through their doors, essentially. And then Pablo, who is located at a Cook County based, so much closer to Chicago, still spoke of the language barrier and the significant issues that they have without having proper adequate linguistic concordance available in their healthcare services. And to address these barriers, community organizations provide interventions that are geographic, region-specific resources. And they do this through lots of different interventions, including the food pantry at the Spanish Community Center. Just to give you a quick insight on how the Spanish Community Center food pantry works, shipments are received on Friday, inventory is conducted on Monday, and food boxes for 100 plus households are all packed and distributed on Tuesday. And it's really amazing what some of these organizations are doing even during COVID. And so although community-based organizations play a key role in facilitating Latinas' access to health and social services, the uneven spatial distribution of CBOs in Chicagoland can compound the challenges Latinas face. Geographic factors do limit community organizations' efforts to assist Latinas with healthcare access. And we can see from this map that I have here that community organizations are not evenly available across the Chicago suburbs in relation to the Latinx population. So what this map shows is the network distance, network travel distance, basically the distance using the road system by census tract to the nearest community-based organization and the percentage of the census tract population that is Latinx. And so the CBO distances are shown using the pink hues on this side of the map of the legend, and then the Latinx percentage population is shown with the blue hues. And so you can see that in these areas of dark blue in the northern and northwestern and even just western suburban counties, some areas with large Latinx populations have extremely long travel distances. And you can also sort of see that yourself because these orange dots are the distribution of CBOs. And so we can see these areas where the lack of CBOs is clear, and these areas of spatial mismatch can be prioritized for locating new CBOs to serve Latinx residents. Differences in CBO distribution in Latinx population throughout these suburbs show there's significant variation in the availability of CBO provided social services throughout Chicagoland, and these long travel times can limit access and strain local services. One community health worker in this area from a CBO talks about the issues she faces with connecting patients to the services they need and being part of one of the few organizations serving this community in the capacity that she does. And essentially, it's just a lot of needs that she has to try and overcome. And so community organizations provide interventions that are both service-based and also specific to the needs and geographic context that they're situated in. These organizations are not providing cookie cutter solutions, but are instead deeply embedding themselves in their communities and seeking to provide the services they see are most needed by their clients. One example would be the Health Navigators Program, a community healthcare access program that was supported by the state of Illinois in response to COVID-19. It's a program that these CBOs quickly embraced and was allowed for them to tailor to their local context because they were able to then support the healthcare needs they were seeing in their communities. And it was widely agreed upon by the CBO interviewees I spoke with that it would help significantly if this program could continue for a longer period of time. We're going to discuss this more in my last paper, which discusses the community organization and federal, state, and local government interactions, but particularly state and local. And so my interviews, this again draws on the purposely selected interviewees I interviewed, show that community organizers interacting with the state find themselves with limited financial support, whether from the state or other donors. They often interact with the state on funding as they recognize a patchwork of programs such as Medicare, Medicaid, and private insurance leave gaps in coverage and needs unmet. Organizations see themselves as working to provide and meet the needs of the communities they are located in and turning to the state for financial support to meet those needs. The role of the government to them is as a major funder of CBOs, but also exemplifies a key aspect of what is often called the shadow state, when government funds coming with strict requirements, thus limit what nonprofit organizations are able to do. Further, resources are limited, and community organizations spoke of difficulties securing financial support, such as this one here, whether because of specific requirements or competing with other community organizations for funds or general confusion. And yet these differing issues also appear to be geographically disparate as in funding distribution. And you can see that with this quote here, where Jessica spoke of this grant that they were trying to get for $12,000. And while that is a lot, it's not as much as other grants, yet had a very involved application process that had a lot of strict requirements for the usage of that money and deployment. However, this organizer at a organization located in Cook County was managing much more funding in terms of in recent times because of COVID-19, and spoke of funding actually increasing and continuing for longer periods of time than was mentioned in Will County. And so, of course, these are different counties with different populations and needs. And remember, CBOs are providing services tailored to the areas they're located within. However, the geographic distribution of organizations throughout Chicagoland is uneven. And so what we have in this map of Chicago, it has the Chicagoland area along with Chicago represented within the black outlined Cook County, and Chicago is a city of over 5 million people. And so of course, we expect to see more CBOs. You can see them here as these black dots, and this sort of the heat map where it shows an increase in CBO locations or a lack of, right? And so we're going to expect to see more CBOs in the area, both given the population of Chicago and the long mentioned history of civic institutional infrastructure. But we can also see that as we move out to the farther suburbs, there are fewer CBOs available, with only few clusters in large population areas such as Joliet and Will County. However, it's clear from paper 2 that Latina immigrant and immigrant-related women are turning to CBOs for social services, and while differences in funding are clear, the government supports this choice by further financially supporting the delivery of these services through the CBOs, in which case this type of distribution leaves clear spots of inaccessibility visible here, which we also saw earlier. So the community organizations I studied for this project are embedded in communities that often experience structurally racist policies and are thus left behind by government entities, especially in crises. Thus, these community organizations that have emerged over the years to support groups who have gone unsupported are crucial elements of the infrastructure of civic institutions in suburban counties. Putting aside the financial component for a moment, if CBOs are working with one another to develop the collaborative infrastructure of civic institutions lacking in more suburban areas of Chicago, I found that they also may achieve more together across issues and campaigns. Clearly, need is great, and those with collaborative opportunities have noted the aid being a part of a larger coalitional group provides. For example, this outreach coordinator in Cook County is located in a hub of organized CBOs, basically, where she mentions that it's both helpful to her to be located at this hub for her clients and provide more services and comprehensive care for her clients and for herself in terms of her mental health and well-being. And she notes she can't even imagine what it's like for smaller towns because her hub still sees a lack of resources, and she doesn't imagine it goes well for those in more rural and isolated areas. And this other quote spoke very clearly of what it means. You know, she saw 2 new community health workers were hired in her area, and she was so excited because it's very simple. It's better if you have more hands. So the development of that infrastructure of civic institutions is also viewed as a way of investing in the underserved communities and supporting health equity. With the case of the Will County Coalition that I'm going to discuss in a little bit more detail in a moment, one of the major pushes they did was submit a proposal to the Will County Board of Public Health, seeking a grant to be paid out to a number of CBOs for them to hire more health navigators for each community-based organization. And so this type of collaboration enables these organizations to work together and push for funding of all of their organizations rather than force them to compete against one another for limited funding. And I do want to say that this proposal was recently funding after a very long campaign. So from researching funding and collaboration opportunities, CBOs must draw on to support Latina women and the rest of their clients. I've come to realize how the geographic variation in civic infrastructure affects community organizations' access to structural supports, such as supportive municipal laws, well-developed immigrant organizing networks, and level of resources. My research found geographic variation in funding opportunities between Cook County and the other counties of Chicagoland through differing opportunities of funding and the types of funding available, not only from the state, but also from community members and both philanthropic and mutual aid based. I also found that there is a difference in the geographic distance of nonprofits outside of Cook County to the built up network of nonprofits throughout Cook County, and the sheer difference in number of organizations to collaborate with that support social services and immigrant rights. Collaboration amongst organizations can also be seen in different stages of development throughout the suburban area, and one example of an established organizational coalition would be the Partners for Community that I mentioned through that other quote earlier. It's a hub of resources and organizations, 17 different organizations with various services located in Cook County. Another organizational coalition is the just mentioned COVID-19 Justice and Equity for Will County Coalition, which is recently developed in response to COVID-19 to support each other's clientele in the Will County community across municipalities and also secure funding together. So, in conclusion, we see that Latina women truly do lack the financial resources due to how their identities are structured by the state, while even when overcoming these barriers, they face numerous transportation and linguistic barriers because of where they're located in healthcare due to the difference in language concordance distribution amongst their physicians and healthcare providers. Meanwhile, the community organizations see these problems are a reality and are asked to address them by the state, and yet lack the resources to fill the role of the state while being forced to compete against one another for economic support. One of the key ways that these organizations may prevent this type of competition is by creating what Jennifer Walsh once called crosstown coalitions, as mentioned, those coalitions that are made across organizations throughout various towns in a region to work together and create stronger infrastructures of civic institutions for marginalized communities to draw on and to sort of fill the gaps of those areas where they're stretched really thin in providing services. We also know the broader impacts of this research come from the fact that Latina women in suburban contexts aren't just located in the Chicagoland area, but throughout the United States. And so if they're facing these issues around these complex challenges here around accessing healthcare, they're probably facing them in other areas too. And so one of the most clear conclusions and impacts is that language support is really crucial, but is also lacking throughout the suburbs, and that community organizations are looked to by both the government and Latina immigrant women and trusted to provide those social services. And so community organizations really do require the geographic specific resource and funding support that can be so helpful and effective to them when they're providing those services, such as the Health Navigators program. CBOs may also, again, find more success working together to pursue creative, multi-pronged proposals from local governments to avoid competition. And personally, I think I agree with all of the organizers I spoke with saying that the Health Navigators program should be extended, because it was clear to them that, and also in a lot of ways around vaccine equity and testing equity, that those health navigators were incredibly effective. So thank you so much to my parents, family, and friends, and my husband, of course. And I mean, just like anybody who's been in my support network, you know who you are. I would take another 40 minutes to say all of your names. Thank you so much for your support. Thank you again to my advisor, Dr. Sarah McLafferty, to my committee, Dr. Julie Seidel, Dr. Guillermo Douglas-Hymas, Dr. Trevor Birkenholtz, and of course, Dr. Edna Budel-Fuentes, who we lost earlier this year, as was mentioned by Sarah. And of course, to the faculty and staff of the Latina Studies Department and the Geography and GIS Science Department. I am so grateful for your support as I've pursued this research. And thank you for your time today. And any questions? I think we have a little bit of time. So, oh, and also there is a paper that will be coming out soon, not about this research specifically, but about the GCamp that Dr. Julia Cisneros and I worked on. So that'll be out soon, hopefully. So thank you. And thank you to the National Science Foundation and the University of Illinois for providing funding support. So that's it.
Thank you, Aída. Great job. So we have time for questions from the audience. Any questions?
Please feel free to raise a hand.
Questions? Don't be shy.
Hi, Soren.
It's good to see you. I've been working on my deck earlier this morning, so I'm a little in a t-shirt here and stuff, but I really enjoyed your presentation. I was wondering, in terms of these crosstown collaborations, have you shared your research with the CBOs, or do you plan to? And just more generally, what do you feel is the role of the scholar in this sort of work?
That's a wonderful question. I'm so glad you asked it. Thank you so much, Soren. So actually, I have shared some of this research in much more condensed form with some community-based organizers, actually as part of that campaign for the health navigators. And that was after I had completed interviewing my participants throughout the area. As both a community member and a researcher in the Will County area, I was very invested in the Board of Public Health meetings that were occurring online. And so I happily was attending them. I actually didn't even know about this proposal until I attended a meeting when it was proposed. And I was like, oh, that's really great. Like, I knew about the Health Navigators program at the state level. I didn't know that there was a new discussion of pushing it forward at the very local level. And I made sure to attend the meetings as they continued to drag and discuss these different points. And as a community member, I eventually felt comfortable as a scholar stepping in and, offering in the public commentary section, hi, I've been studying, CBOs for the past year, and part of their responses to the pandemic and regarding healthcare access and for minoritized communities, which is the big push of why they were doing this proposal. And I just wanted to say I could support that. And so then when the government officials of this board heard that, they were eager actually to see my research. And so I said I would be happy to share a brief, essentially. And so I put together a very short brief talking with some of these community organizers, asking them, hey, what do you think would be most effective in terms of, because I knew what my research was showing. So I wasn't like trying to make it fit a certain agenda. I knew what I was showing. I was able to say, look, I've done the research. It seems to be effective. So here is what I have. And so I think it's something that has to be specific to the community you're working in. I think it takes knowing the community and even being a part of it in some way. There was clear appreciation by the CBOs when I spoke to them later about me speaking up, because they could see the government officials have a very different reaction to my commentary as a scholar, as opposed to community-based organizers who often have a very different sort of relationship with government officials. And so it was one of these situations where it was very positive. It came after me attending, I would say, at least 5 of these meetings and not saying anything. So I really was very conscientious of what my role would be, and I was very careful to be very specific in what I was going to contribute and do in terms of being a scholar in that situation. I'm very comfortable being a community member and just, showing up and assisting in some way, right? In a way that anyone can assist in a valuable, important way. But making my scholarly contributions available is something that I continue to take very conscientiously. So it was a very long answer, but that's a really important question.
No. Thank you so much for that, Aída, because as you know, I work in similar kinds of spaces. So it was really helpful to hear you reflect on that. Thank you.
Yeah, absolutely. Julia, I think you have a question.
Hey, Aída, again, another great talk. And it's so cool to see how you've just progressed in this project, even from a couple of months ago when I watched a talk a couple months ago. So I'm always very interested, because I know that you were going to these board meetings and I know that you were learning a lot. And I wanted to know, how do you think you could work with them, or what do you think your work could inform and help them think about in future planning for even things like other infrastructure, like transportation and stuff like that? I know that you've been thinking about that a lot, so I want to hear your thoughts on that.
Absolutely. That's also a really great question. So as part of connecting with these community organizations, actually one of the first organizations I spoke with was through a connection, a friendly scholarly connection. And I met with these organizers, and they asked me about what my interests are, my research interests are, what I was hoping to do with them to collaborate. This was before I was even interested in specifically researching community-based organizations. And after hearing about my work and my interests, they were like, we have this meeting that's coming up. Would you mind attending and listening? Because it has to do with environmental justice issues and the development of new transportation in one of our heavily Latinx neighborhoods. And I was like, yeah, of course, I'm happy to attend. And there weren't any expectations put on me or anything. But as I attended that meeting, it was this Department of Transportation liaison coming and saying, we haven't heard from the Spanish-speaking community, and I really want to make sure we get their public feedback. And I listened. I asked maybe one clarifying question at this talk. There were a number of people there. It was online. And I left that meeting and I was like, okay. And then I did some research, as a researcher does, just online. And I found a lot more information about that campaign and project that the Department of Transportation liaison was referring to, and found that the time for public comment was actually ending in a month and had been ongoing for the past 2 years. And so once I had done that sort of examining of the situation, I realized that there was a very different set of circumstances around receiving public comment from the Spanish-speaking population, as opposed to the non-Spanish speaking population in this area. And I made sure to incorporate that into my feedback just to the community-based organizer that I was talking to, who had invited me to the meeting, rather than anything else. And it was just so that way what we realized after communicating about it was that maybe in the future, more longer term efforts from CBOs could be a push for more clear expectations around receiving public feedback from people from multiple language backgrounds. So including around transportation, especially since they had that liaison who I think really was invested in getting that feedback, but just had been brought in too late into the project for it to have a significant effect. So do we have time for one more question, I think, sir? Okay, so Benjamin, go ahead.
Yeah, thank you so much, Aída. Wonderful presentation. One of the things I hear often in thinking about geoscience and earth science education is that one of the barriers to that is people don't know that geoscience or earth science is something that you can study. One of the things I find really powerful about your work is it actually shows how people's not every day, but experiences that they might consider every day are actually a really rich source of information about how our world works and people's relationship to place. And my question is, if you learned anything from the folks that you've been interacting with in the course of this research about like what the discipline of geography means to them, or have you learned anything about the way you consider geography or your work as a geographer through doing this research?
Yeah, that's a really great question. It's so important. You know how near and dear those things are to me. So, but yeah, I would say that I think geographers even sometimes don't give everyday people enough credit for how much they are thinking about the impacts of geography on their lives. They just maybe don't use the same terms that we do. You know, I saw these like obviously spatial. I wasn't even really pushing in some of my open-ended questions, even in my survey, too much on the spatial component. I just was asking for their experiences. And the Latina women who responded often included very spatial details about time and distance and cost and like how these all interact to just create these really complex healthcare access landscapes. And then the community-based organizers also were very aware of the impacts of geography and especially how I wouldn't say arbitrary, but constructed borders and boundaries that we have in the United States and specifically in the state of Illinois impact their ability to provide services to a wider surface group and actually thus affect how they advertise and market their services and who they're giving them to and what they're able to do in order to serve as many people as possible. And so those are some of the big, I think, larger, this is geography and it is important and powerful points I sort of saw. And as a geographer, I am excited for what else there is to do and what the field can offer healthcare access, can offer people from these often very marginalized communities and the people who are trying to support them. So I'm really excited for what's next.
Thank you. Really wonderful,
yeah.
sir. Thanks for a great presentation.
Michael?
Yeah, Aída, I'm joined with everyone else in saying it was a wonderful presentation, and thank you for the work you're doing. And this is very exciting for where this will lead in the future. My question for you is about your use of GIS. And one of the things I think you started off with was a very legitimate critique of GIS, that most of the data is state data and reflects that particular set of subjectivities that's associated with the state. The thing I noticed, though, in seeing your maps, it seemed like most of them did use state data, that you were using drive time analysis, you were using, and in a very legitimate way. I mean, the way that you were using was certainly in a critical manner. But I'm wondering in any of your, and I know, doing novel GIS work was not necessarily what your project was about, but was there anything along the way that you were thinking, it would have been interesting if I could have done this using Cartesian space as opposed to the subjective spaces that you were dealing with?
Absolutely. I mean, well, I will say actually, most of the data was state-based. two pieces of data were actually constructed in novel GIS method, I guess, or at least in the sense that the data didn't exist prior to this project in the way that I formatted it. So while yes, of course, I collected data and spatially applied it for my Latina participants, I also spent a very long time over the holiday break constructing a database from scratch of community-based organizations that were 501c3 nonprofits from a variety of sources. So that included, of course, GuideStar, which is a very well-known, well-regarded charity review organization or 501c3 nonprofit review organization, but also looking at specific state and even university and community organization databases that were available online, targeting specifically the Chicagoland area, although I did capture data from throughout the state, and looking for specific like smaller lists and bringing them into the larger fold of this broader data set. And so I actually have other maps and other analyses that I performed around community-based organizations and the types of services they're providing. But so that was one thing, right? And honestly, if I could have done, there's a lot more I could have done with that I would have. And I think it would have been a whole separate chapter if I had dedicated that time to, scraping IRS statements, which is something that actually a lot of papers have done on this topic, and to create lists and also to, curate those lists and focus on ones that I know are active and provide a certain set of resources, and focusing on those in Latinx communities and what their service provision area looks like. So there's a lot more actually that I look forward to doing as I have more time and more resources to do that work within. So this was a very qualitative component. And there's a lot more interactions actually at play that I didn't get to incorporate into that first chapter between community-based organizations that are providing healthcare access services specifically, very specifically, and the Latina women who are trying to use them. So there's a lot. I could go on. So
excellent. Yeah, thank you, and good luck with it. I look forward to seeing the research that comes out of this. Thank you.
thanks, Michael.
Okay, now we will have to quit with the audience participation, and let's all give Aída a round of applause, virtual applause or any type. Great job.
Woohoo! Excellent job.
Thank you so much.
And great to see all Aída's support network here, at least part of it.